Good afternoon, everyone, and welcome to the 30th Annual General Meeting of Dental Health Services Victoria. My name is David Stevenson, and I'm very proud to be the chair of the DHSV board. As we gather for this meeting from various locations, let's take a moment to reflect on the meaning of place, and in doing so, recognise the traditional custodians of the land on which we stand. I'm joining you today from the lands of the Wurundjeri people of the Kulin Nation and pay my respects to their elders, past, present and emerging. We acknowledge the traditional owners throughout Australia, wherever you may be joining us from today, and recognise their continuing connection to lands, waters and communities. This meeting is open to the public. An advertisement notifying the community appeared in the Age newspaper on Saturday, 2nd of November 2024. We also advise people via the DHSV social media channels. Our AGM is going to be a little bit different this year in that I'm not going to present all of the highlights of the year. Instead, I'm handing that privilege over to the DHSV executive team, who under the strong leadership of our CEO, Susan McKee, and the broader amazing DHSV staff, they are the ones that have delivered these fantastic results. Rebecca Paterson, our Chief Operating Officer for the Royal Dental Hospital of Melbourne, will share how we're transforming the hospital into a centre of clinical and operational excellence. On that note, the hospital underwent a short notice accreditation last month with a very positive report and no recommendations for improvement. This is a remarkable achievement that represents the high standard in patient care and service delivery. Huge congratulations to Beck and the entire RDHM team. After the hospital update, Mark Sullivan, DHSV's Chief Operating Officer, will share highlights from the Smile Squad, our innovation grants and our population health programs. Mark will also talk about how we partnered with community dental agencies across the state to find new and innovative ways to extend our reach and impact. Despite the ongoing workforce challenges, our community dental agencies treated over 286,000 individuals and significantly reduced waiting times for care. These partnerships are also vital in delivering oral health promotion programs and helping us reach a significant Smile Squad milestone of 100,000 children treated. We are thrilled with that result. Mark will hand over to Zemeel Saba, our Chief People and Culture Officer, who will share the details of our people plan and various workforce initiatives. To address workforce challenges, Zemeel and her team focused on enhancing the employee experience and building our future workforce through various traineeships, graduate programs and new incentives. Nuno Goncalves will share a progress update on the electronic oral health record, which is a single statewide oral health patient record and an identifier for Victoria's public oral health sector. This is truly a game changer for us. Then we'll wrap up the AGM with our DHSV CEO, Sue McKee, sharing the plan for the year ahead. When I was thinking about how best to describe the 23-24 year, I kept reflecting on DHSV's impact on the community, on the oral health sector, and on the broader health system. When it comes to health agencies, DHSV is actually comparatively small, but we don't play small. We have a bold vision to create a Victoria that is disease and cavity free, and we are tenacious and committed in our pursuit of that. We are recognised as a global leader in value-based healthcare implementation. We have a benchmark network with primary care providers, schools and communities across Victoria that has supported operational efficiencies and system reform. We've launched Victorian First programs to close the gap in Aboriginal health outcomes, which continues to be a very important priority for us. And we have world-class clinical staff delivering best practice, integrated and patient-centred care. However, we've also faced challenges throughout the year and we continue to do so. We are impacted by the challenges our community, our health industry and our team members face. We are not immune from those challenges. We also didn't get everything right throughout the year, and we want to be able to own those opportunities and learn from them to make sure that we become better, stronger and more committed than ever. Our approach is simple. With a clear vision, fantastic team, strong partners, and plenty of determination, we'll continue to deliver extraordinary outcomes. So to everyone at DHSP, I say thank you and keep it up. Thank you for everything you've contributed to DHSP this year. Keep striving to improve oral health outcomes. Keep making a profound impact in collaboration with our partners. Speaking of our partners, I'd like to thank the Minister for Health, the Honourable Mary-Ann Thomas, for her ongoing support of the public oral health sector. I've been fortunate enough to spend some time throughout the year with the Minister, and her passion for improving Victoria's public health system and DHSP is clearer and more driven than ever. Special thanks also goes to our department, to our colleagues at the Department of Health, our Community Dental Health Agency, our universities, as well as our oral health advocates across health, education, early childhood, diversity, and cultural advancement. Thank you for your continued support and investment in our vision. I'd also like to thank each of my fellow board members for their contributions, expertise, counsel, and support. It's an absolute pleasure to work with and learn from every one of you, and I appreciate it. Special thanks to the DHSP executive team under the strong leadership of our CEO, Susan McKee. You've managed to navigate the challenges of 2024, capitalise on the opportunities, and we are well set up for an exciting future together. To every person who works within the Victorian public oral health sector, you are the reason why we managed to provide quality care to over 346,000 people last financial year. You are making a difference in the lives of so many Victorians, and we appreciate it. And importantly, to our patients, you are the reason why we exist and why we get up every day and strive to be better. Thank you for trusting us with your care and providing valuable insights to improve the way we design and deliver that care for all Victorians. I'd now like to hand over to Rebecca Paterson, who will talk you through the key achievements of the Royal Dental Hospital of Melbourne. Thank you very much.
Great, thank you, Dave. And thank you for giving me the opportunity to share the 2024 highlights for RDHM, and I'm very pleased to say that many achievements have been made. Late last year, we launched the RDHM Beacon on the Hill strategy, centred around the pillars of care, teaching, and research, and this has guided us in our pursuit to become the leading teaching and training organisation and centre of excellence for our patients. Whilst we've had many projects and initiatives underway throughout the year, I'm pleased to talk through some of the key highlights and have grouped these around our measures of success themes of access to care, efficiency of process, quality of care, and our people. Over the past 12 months, more than 43,000 patients have accessed services at RDHM, which has accounted for over 90,000 visits to the hospital for emergency, general, specialist and surgical care. And this is an increase of over 9,000 patients when compared to last year. We have achieved this by increasing our access to care by improving our processes around patient appointment scheduling and reducing clinician vacancy, which has improved our capacity to provide more care to patients. This has also included the introduction of new models to improve access, such as the paediatric standby patient list in the day surgery unit, expanding the multidisciplinary clinics to our specialist services, and embedding the primary care walk-in model that we implemented in the latter stages of last year. We have developed a new and revised waitlist and booking procedure to guide our clinical and administrative staff and to streamline our processes to enable timely access to care. And this has been supported by the development of revised letters and tools to improve our communication to patients. I'm also pleased to report that the activity levels, which is the key outcome measure of patient access, are tracking in line with budget and is currently at 14% higher when compared to the same time last year. This year, we have seen some significant improvements and impacts of the two key operational improvement projects that we commenced in the latter stages of 2023. Our scheduling redesign project has resulted in streamlining the patient booking processes, strengthening our appointment confirmation processes, and introducing real-time booking of the patient's next appointment before they leave. These initiatives have seen an increase in patient throughput through improved productivity in the chair, a substantial reduction in the number of patients who have failed to attend for an appointment, and an overall reduction in the number of patients waiting for care at RDHM. In the day surgery unit, the Productive Operating Theatre project has been focused on improving the storage of stores and equipment so clinical staff have what they need at hand, reviewing the theatre schedules to optimise the capacity of the theatres, improving the patient preparation processes prior to surgery, and improving the in-theatre processes to optimise patient flow. These initiatives have seen a significant and sustained growth in the activity through the day surgery unit, which has enabled more patients to access care and treatment. This year, we have implemented a new rhythm of performance to track and monitor activity across the hospital and introduce a tracker to assist in understanding the drivers of activity in real time and then to identify opportunities for improvement. This has had a really positive impact on how we've prioritised the areas of focus and strengthened our ability to forward plan. This year, our patients have reported a very positive experience through our patient-reported experience measures. Each patient is invited to complete a survey after their visit to provide us with feedback on their experience. In 2024, 94% of patients rated the quality of treatment that they received as good or excellent, which is a fantastic result. We've completed a body of work to improve our complaint and incident management processes to ensure a timely response and closure, and this has resulted in a significant reduction in the number of open incidents. We've strengthened the system to enable better use of the insights and learnings from incidents and complaint themes to inform quality improvement projects across the hospital. We set ourselves an ambitious quality plan this year and successfully completed a number of the quality improvement initiatives to ensure that we are delivering high quality, safe and reliable care across the clinical areas. We've partnered with our consumers to co-design and get feedback on a number of improvement initiatives such as the ground floor renovation project, several of the patient scheduling redesign initiatives, patient information that has been reviewed, and we've also introduced consumer representatives onto the RDHM Quality and Safety Committee. As Dave mentioned in his introduction, in November we underwent accreditation against the National Safety and Quality Standards, and we're delighted to have all action items assessed as being met with no recommendations, which is a truly fantastic outcome. In the accreditation summary at the end of the survey, the assessors made particular mention of the high quality of care that was being provided, the strength of the interdisciplinary teamwork between our clinical staff and the patient-centred approach to care, and the strong alignment of staff to our organisational purpose. We've also progressed the Capital Works program and have installed new theatre pendants and lights in the day surgery unit, as well as creating new sterile stock storage within the theatre complex. The ground floor renovation project is well underway, and further works are planned in the hospital to replace the sterilisers and install a reverse osmosis water unit in CSSD, and to install additional chairside X-ray arms in the level 1 and 2 clinical areas. From a people perspective, over the course of this year, we've welcomed 107 new members of staff to RDHM. This has included a number of staff who have joined RDHM through our targeted workforce and novice workforce initiatives, which has included 16 dental assistant trainees as part of the Dental Assistant Trainee Initiative, 6 graduate dentists and 4 graduate oral health therapists. On completion of these programs, we've maintained a high retention rate of these staff who've transitioned into ongoing roles at RDHM, which is a great outcome. In August, we implemented a new clinical administration structure across RDHM to create functional alignment to the clinical service delivery and to support and improve the patient and clinician experience. This structure has enabled us to scale up the process improvement initiatives associated with the scheduling redesign project, and to create standardisation across primary care, integrated specialist care and surgery and oral medicine. Throughout the year, we have continued to work closely with our university partners to strengthen the teaching and learning environment for students, and just wanted to recognise the significant contribution that the students make in providing access and care to our patients. We've worked closely with the University of Melbourne to review the operating protocol to ensure clarity of roles and responsibilities to enable student learning. We have made revisions to the model to enable staff to supervise students, and have worked collaboratively with them to enable the introduction of the university's new timetabling system, which will then enable RDHM to take on responsibility of the scheduling of patient appointments for students. In closing, RDHM has had a fantastic year and we have achieved a lot. I would just like to take this opportunity to thank all of the wonderful staff who come to RDHM each and every day and provide excellent care to our patients, as without them, none of this can be achieved. I look forward to another great year in 2025. I will now hand over to Mark Sullivan, our Chief Operating Officer for Statewide, and he'll take you through working through with our partners. So thank you.
Mark, you're on mute.
Hello, everybody. Mark Sullivan. Thank you for the opportunity to celebrate some of our successes over the past 12 months. It's been a really exciting 12 months, and if I pick up on what Dave mentioned earlier, that we are pretty bold. We stretch our wings far and wide, and we have a pretty bold strategic direction. And one of the challenges here is we can't do it alone. So how do we partner with people, not only within the oral health, but also the non-oral health sector? So if I just hit some highlights, and I'm looking at it from a strategic point of view, and we have a care pillar, we have a leadership pillar, and we also have an empowerment pillar. What I'll go through first is the care pillar. Dave mentioned that we've reached 286 individuals for treatment across the state of Victoria, which is a great achievement. But one of the ones we're really, really excited about is the wait list. And you hear a lot from people around their communities that it takes a long time to get dental care. We've seen a trend going over the last few years. The last 12 months, we've seen a drop from 17 months to 11 months for general care. That was somewhere around about 22, 23 months in the previous year. So we're trending down. We're not standing on our laurels here. We're going to actually try and achieve a better result. We want to get it under 10, so we'll keep working towards that. From a denture point of view, we've gone from 17 months to 11 months. There's some exciting news there. We've got some new technology, and I'll talk about that a little bit later to help us reduce that time frame. And over 51,000 people that require care, urgent care, are seen within the 24-hour window. So that's pretty exciting. We can't do it alone, so we've partnered with the CDAs. And the last 12 months, we've worked really closely with private providers. And you see there some stats that we've worked with 2,000 private providers in their companies, and also 3,000 individual private providers. So that's a great outcome. One of the flagship programs is the Smile Squad program. As Dave said, we were really excited to get the 100,000th patient treated, over 60,000 this year, 191,000 health packs. The health packs are really there to start the journey and introduce that early intervention prevention. A lot of people, a lot of parents didn't know where to go for their local oral health services. That packet actually sets the scene and allows that to occur. Another exciting component of the Smile Squad is the 3 specialised hubs. The 3 specialised hubs are in Bendigo, Latrobe and Barwon. So I'd like to thank both Bendigo, Latrobe and Barwon Health for establishing those hubs. This allows people to travel probably within the vicinity of 50 k's to their nearest clinics, rather than coming all the way into Carlton to receive treatment. So we're really excited about that. One of the other exciting components is working with Zeus Victoria. The staff love it when they go out. The community loves it, and we've seen a number of kids being treated out at Melbourne Zoo and also down at Werribee. The other exciting thing is 35 primary school nurses were trained prior to the end of June. In doing this training, 35 of those staff said they weren't aware of what oral health services existed in their community. They didn't know what to do with their children, and now 35 nurses are pretty clear what they need to do from an oral health perspective. They know where their nearest clinic is. They also have an understanding of when the vans are coming through to the service. An update on that, we have now trained 106 of those primary school nurses. So that's a great achievement. So we've gone from 35 to 106. Thanks, Sue. Now moving into the empowerment component, and this is our health promotion. We have a Smiles for Miles program that works in early childhood settings, and these are in the most needy areas across the state of Victoria. We're working with 775 early childhood services and reaching just over 60,000 kids. The journey of that is, how do we actually dovetail that into the Smile Squad program, and how do we capture their oral health status all the way through their life course? Another area is we've trained over 1,600 oral health professionals. So as I said, we can't do it alone. We need other people to assist us in that. And they are people like maternal and child health nurses, early parenting staff, Aboriginal health practitioners, and disability workers. We've had an exciting program where there's a bit of a breakthrough in the Aboriginal space, where we've trained 6 Aboriginal health practitioners to apply for Advantage in their own environments. There was a lot of work involved, thanks to the department and a lot of staff, to make this happen. The other exciting area is GPs. We've always struggled to work with the GP community. The oral health cancer program has allowed us to work with GPs and the early intervention of detecting oral health cancers. And we've distributed over 1,500 education resources across the state. You can see there that we've partnered with quite a lot of areas, Zoos Victoria. We've worked with the GP community and a number of non-oral health practitioners. The other component is within the lead. So this is an exciting component where we can make a difference. We can set the standards. We can actually do other things within the community that other organisations can't do. For example, we've funded 13 projects, innovation grants, and you can see the innovation grants there. 2 that I'd like to call out is the digital denture feasibilities that we have there. Sorry, my screen is breaking up. Can you hear me? Sorry, I'm getting feedback. The digital denture feasibility study is an opportunity where you can scan the patient dentures and put them into a machine overnight. They create dentures and the patient can pick the dentures up the next day. Generally, that could take 3 to 5 visits. So we're pretty excited about that. That will have an impact on reducing the waiting list of 11 months as we go forward with that. The other one is clinical placement model. This is a future pipeline for us from a workforce point of view. If we can get this right and work with our undergrads through a clinical placement, then into a graduate program, we'll build the capacity within the public sector. So we're pretty excited about this model also. So once again, just to close, I apologise for the static going through, but what I'd like to say is we can't do it alone, and it's a great opportunity. You can see how many people we partner with across our ecosystem. So thank you very much. And I'll hand over to Zemeel.
Thank you very much, Mark, and it's my pleasure to share with you some of the many highlights in relation to our people and our workforce initiatives over the last 12-month period. And as Dave actually has talked about, obviously at DHSV we have a strategic direction. But what was actually really important is that DHSV didn't actually have an aligned people plan to actually enhance and enable the achievement of our strategic direction. So after considerable consultation with our board, with our people, with our consumers, there was the design of the DHSV 24-27 people plan. And that plan was endorsed by the board early 2024. And the plan really had 4 key pillars. And the pillars you can see are outlined on this slide. So Come and Stay is a pillar that actually highlights all of the programs and initiatives that we need to do in relation to workforce attraction and workforce retention. Because it's incredibly important to not only attract a workforce, but to retain through things like career pathways, through working in a great environment with a great culture. So Come and Stay really focuses each year on an annual program of work. In relation to Learn and Grow, I think as Becca talked about with Beacon on the Hill and obviously with RDHM, we are a teaching and learning organisation. So this pillar really featured a range of initiatives, not only to enhance being a teaching and learning organisation through a novice workforce, but also how can we grow all our people with initiatives such as a new learning management system that we're able to roll out to enable people to be empowered to also learn themselves. Well and Safe is our third pillar, and this was a pillar that had a range of programs and initiatives that would very much focus on how our people need to be empowered and own being well and healthy at work, but also how DHSV ensures that you have a safe working environment and a great place to come to work each day. And our Engage and Belong pillar really actually looks at the heart of continuing to engage with our people in the co-design of programs and services for our consumers at DHSV, but also culture. Because culture is at the heart. If you have a great culture, you actually feel like you can bring all of self and belong in your work environment, and that you want to actually have a career working in oral public health. So these four pillars and their associated program of work were rolled out during the last year, and there've been some terrific achievements, and I'd like to just highlight a few. So one is we obviously had a focus under our pillar of Come and Stay, which is our novice workforce. And there were two wonderful programs that really were the highlight of our year. So one is our Dental Assistant Traineeship Initiatives, or DARTI, and we were given a great hairy target of trying to recruit and place and put through our wonderful program 100 DARTI trainees, and we reached 102, which was fantastic. But what was more important was the amount of people who actually then went to have permanent employment at DHSV, and they want to grow a career. And the feedback from our DARTI trainees about the experience of being a trainee was phenomenal. So you can do a traineeship, but if the quality of the traineeship is high, you will actually want to stay and develop your careers with us. We also had our inaugural oral health graduate program, and we went out to our university partners and our graduating students and thought, gosh, if we could have 10 participants, that would be really terrific in our inaugural program. And we had 36 participants, and they're close to finishing in March actually of 2025. They'll finish their graduate year, but what we did was ensure that the experience of the graduates was really well supported with coaches for the oral health graduates, with really good wraparound teaching support as well, so that they're really able to form a great community of practice. And again, the qualitative and quantitative feedback from our oral health participants is that they now actually want a career in public health as well, which is wonderful. It was also really important for DHSV with our Gender Equality Action Plan that we continued to implement a range of initiatives in support of gender equality at DHSV. With a workforce that is a feminised workforce, and 73% of our colleagues identify as female, it was very important that we continued to do things like close the gender pay gap, and I'm really pleased to announce that we reduced that by 4.8%. But more than anything, ensure that anything and everything we do, that we put a gender lens across it. So the introduction of our gender equity impact assessments also helped DHSV put into place a range of actions to enhance our gender equity action plan. There is no doubt that our people, if we're going to grow careers for our people, we need to make sure that we actually focus on career pathways and capability building. And that's actually in two dimensions. One is that we grow leaders both now and for the future, but the other is actually we grow clinical excellence. So under our Learn and Grow pillar, we also looked at the design and then the implementation of both people leadership capability and clinical leadership initiatives during the last year. And our people told us loud and clear in our culture and engagement plan design and delivery that they want to be a part of anything we do associated with products, services and programs moving forward. So in our culture and engagement plan, we've really made sure that we listen to our people, we involve our people to make sure that we have a culture where people feel included, but they feel engaged. And we're also really excited that a piece of work was done in relation to our values refresh, but we will look forward to the rollout of that in 2025. And again, the values refresh was the voice of our people, by our people and for our people. So thank you very much. I wish you all well, and I'll hand over now to Nuno to talk further about EOHR.
Thanks, Zemeel, and good afternoon, everyone. So I'm very excited and proud to present to you an initiative 7 years in the making. The EOHR project has set out to roll out a single electronic oral health record platform for public oral health in Victoria. This will be rolled out to over 56 locations across the state. We aim to consolidate replicated patient oral health records that may reside on multiple systems and locations into a single patient record. We also aim to provide a single patient oral health record number that provides, making it easier to provide the right information to the right person at the right time. With that, the introduction of an information sharing capability into the wider healthcare system that's supporting our patients through their, not just their oral health journey, but their wider health journey across the health system in Victoria. And ultimately, all this aims to improve the experience of both our staff and our patients with our interactions with our services. This year, as you can see there in our journey for 2024, marks a major milestone both for the project and Smile Squad as the first service to go live with the platform. And timing has it that the switchover is actually happening tonight, which is very, very exciting. So next year, we have a long journey ahead as we continue to roll out the platform to our many oral health care partners with the goal to establish the single electronic oral health record in Victoria and provide that refined process across the state and our oral health system. So that was a brief introduction and update to where we're at. We're very excited for tomorrow with Smile Squad taking on the and cutting edge, being the first off the rank to utilising the platform. And we're very excited to hopefully next year be sharing some more good news as we roll out the rest of the platform to the rest of the public oral health services across our system. So I'll leave it at that and I'll pass it on to Sue. Thank you. You're on mute, Sue.
Too many buttons to press. Thank you, everybody, Beck, Mark, Nuno, and Zemeel for sharing those highlights. We've obviously achieved a great amount in the last 12 months, and we're set to have an even busier 2025. We have a bold vision of a Victoria that is disease and cavity free. Our strategic direction is supported by an annual business plan that keeps us accountable and on course. We've recently finalised the 2025 business plan, so I'd like to talk you through some of the major projects and activities that we'll be undertaking in the 2025 calendar year. The rollout of the Smile Squad continues to be an important focus for us. The program provides free oral health care to children at government schools across the state, making it more convenient and affordable for families to access care, which has become increasingly important with the cost of living pressures that everybody is under. In 2025, we will continue to partner with community dental agencies that play a pivotal role in delivering this program. Our focus will be on increasing the number of schools we visit and the number of children that we see. This includes increasing the Smile Squad consent rates, reviewing the private practice model and maximising the use of the federal funded child dental benefits scheme. Beacon on the Hill is our second priority project that encompasses a range of initiatives to transform the Royal Dental Hospital of Melbourne. In 2025, we'll be looking at how we can strengthen our university partnerships to continue to position RDHM as the leading teaching and training environment and a centre of excellence for oral health care. We will also build on the incredible work that Beck and her team have done by optimising the emergency services and reviewing our funding models. Around April next year, we'll be really excited to unveil the ground floor redevelopment that will make the hospital a more welcoming environment for our patients, staff and families. As most of you know, we continue to face workforce challenges across the state. Our workforce strategy focuses on accelerating the attraction and retention of oral health workers to the public oral health system, prioritising employee experience and professional development, and partnering to build an oral health workforce. In 2025, we will lead the design and delivery of a novice workforce in partnership with our education providers. We expect our dental trainee initiative scheme to deliver 50 DA trainees and our oral health therapist graduate program to deliver 30 graduates. Out of these oral health professionals, our aim is to retain 80% in the public oral health sector going forward. So a big, bold aim as always. Value-based healthcare aims to transform the way we design and deliver services by shifting the focus to prevention and early intervention, equity and sustainability. It's about moving away from volume-driven healthcare to provide a model that promotes the outcomes that matter to people and communities. We recently employed Sonia Coleman, our Director of Value-Based Healthcare. Under the guidance of our Chief Oral Health Advisor, Werner Bischoff, Sonia is leading the development and execution of a comprehensive strategy to further embed the principles of value-based healthcare across DHSV and our community dental agencies. Some focus areas for 2025 will be revising how patients interact with DHSV and how DHSV wraps services around the patients and looking at new ways to measure outcomes. We'll also continue to implement value-based healthcare through the Smile Squad and our 3 specialised service hubs. Financial sustainability will continue to drive our decisions. In response to the financial requirements laid out by the Victorian Government on all Victorian public health services, we have significantly reduced expenditure across all areas of DHSV. These changes have been crucial in ensuring we remain financially sustainable and can continue to provide the vital oral healthcare services to the community. Another area of focus for 2025 will be supporting the government with the Health Services Plan implementation. Part of the plan is establishing local health service networks, which are geographic groupings responsible for planning and managing care so that it meets the needs of the community. Once DHSV's network partner has been announced by the Minister, we will actually continue to work with our partners to support more equitable and consistent care for Victorians and strengthen our health workforce. In addition to these 5 key initiatives, we will continue to roll out our population health programs and campaigns. We will lead cultural reform by embedding the DHSV way. We'll continue to generate evidence to inform decision making and leverage technology to streamline our processes and partnerships. I hope that has helped to set the scene for 2025. It's going to be another really busy year for our organisation, but our organisation is filled with dedicated and skilled people who are driven to improve the lives of those in need. I'd like to echo Dave's sentiments and thank everyone who is working with us to create a Victoria that is disease and cavity free. I'm immensely proud to lead this organisation in doing such vital work. I'd like to thank my executive colleagues for driving all of the initiatives that you just heard about today and to continue to drive those in 2025 to improve the oral health outcomes for our community. I'd also like to thank the board for their support and stewardship of our organisation. I will now hand back to Dave to close the AGM.
Thank you very much, Sue, and thank you everyone for your presentations and for all of the people joining online. We really appreciate your time in being a part of this important AGM. So with that, I'd like to bring the 30th Annual General Meeting of Dental Health Services Victoria to a close. Thank you all for attending today. We really appreciate it. I hope you have a relaxing, enjoyable break and looking forward to 2025, feeling energised and excited for what's going to be a fantastic year for DHSV. Thank you very much and stay safe. Take care.